This podcast is sponsored by packs. Whether on the water, on land or in the air, packs bags are both versatile and flexible backpacks that are perfectly suitable for your requirements in the most demanding of environments. Packs bags are highly regarded due to their exceptional performance in pre-hospital and in critical care environments. Their well-organized compartments and customizable configurations enhance efficiency in high-stress situations. They're designed with infection control in mind and are easy to clean and disinfect. So highly visible colours and reflective strips aid quick identification and adherence to quality standards, ensuring reliability. So the versatility of packs bags caters to diverse EMS providers, and they deliver vital equipment, durability and ease of use for pre-hospital critical care services globally. I've used packs bags in a number of critical care situations, and they're absolutely excellent, both in identification of kit, but also in identification of the reflective strips to ensure visibility. So please see the show notes for further details.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.
Welcome back to the podcast. In this episode, we're going to be speaking about AI-enhanced virtual reality simulation for medical training. What I wanted to do in the episode is really delve into the latest advancements and innovations of XR technology, so the world of extended reality, and its groundbreaking application in medical training and how it might shape the future of medical training and practice. So from real-time communication with patients to integrating emotional intelligence for more empathetic interaction, to enhancing clinical guidance through AI-driven doctors, simulating injuries and diseases with high accuracy, this platform is set to transform the future of medical education. So in this episode, we're really going to unpack the potential challenges and future of this technology. So to do this, we're joined by Martien Strik. Martien is a critical care nurse with more than 13 years experience in clinical and pre-hospital medicine. He's also got 8 years in virtual reality experience and recently joined the team for tactical VR as part of medical simulation, alongside William Kirkpatrick, who is the CEO and founder of Tactical VR, who's also a critical care nurse in the field. Welcome, Martien, to the podcast.
Thank you very much.
I wondered if we could just start, Martien, by just getting you to unpack and speak to just what XR technology is, and indeed how it is sort of transforming with AI the boundaries of medical education.
Yeah, so extended reality, the abbreviation of XR, extended reality, is an umbrella term for augmented reality, virtual reality, and mixed reality. The easiest way to explain is that augmented reality enhances your physical space with a digital asset. So, for example, a digital lamp is placed in my physical space. I can't have real interaction with it. Virtual reality is that you're being completely immersed in a virtual environment, so you don't have any contact with the physical world. And mixed reality, also sometimes being stated as spatial computing, is the blending of both worlds. And an easy way to understand is that you either feel something physical in the virtual reality. For example, there's a great application where you are placed in a virtual environment, so you don't see the physical world. And then you will have a physical mannequin. So you will see a virtual patient and you will feel, performing heart massage, you will feel a physical mannequin, but you will see a virtual patient. And another great application of mixed reality is where you place your virtual patient in your physical world. So for example, in EMS, you can place the virtual patient in your own rig or on a gurney or on the street or in a house situation.
So could I get you to speak to how AI is starting to really replicate real-life patient interactions just through AI-driven communication and indeed verbal commands, and how you've kind of embedded that into the technology?
Yeah, like important to understand that I don't do that myself, but Will Kirkpatrick with the team of Tactile VR have developed on one hand their own dynamic artificial intelligence and also using existing AI elements, learning machine elements. But the best, for me, the most simple way to talk about this or to explain it is that I compare it to a virtual patient actor. And I can say to the virtual patient actor, being the AI, like, okay, you're a man or a woman or a child, this age. You have this is your background. You live in Colorado. You like, this is your hobbies. You have pets. You can make it as detailed as possible. And then on the other hand, you will say to the virtual patient, like, okay, this is your injury. You have a neurological injury. So you might not be able to lift up your arm or understand certain questions. You won't remember certain things. So that you can make it very short or you can make it a very comprehensive part. And for example, like psychiatric patient, you can, with possible hallucination, you can say, okay, you can tell or say to the AI patient, you set up the AI patient like, this is what you still remember, this is that you don't remember, and that there are certain parameters where you can say, this is what you still remember. You have two forms of AI. You have your static AI and you have your dynamic AI. And static AI means that the AI will trigger a certain response on certain trigger words, for example, CPR. So in the simulation with static AI, when I say CPR, there's a trigger word, the AI will give a certain response. Maybe the patient will do something or a colleague will do something. But if I say cardiopulmonary resuscitation, nothing will happen because the AI didn't recognize the CPR. And of course, you can, as a developer, you can put in different abbreviations. But there's always the limit that you didn't use the correct word or catchphrase. And dynamic AI is a more intelligent response. It understands the context more. So, for example, if I'm with a patient and I will say to myself or to a colleague, like, I think the patient is going into a cardiac arrest, the AI will understand that means cardiac arrest means CPR setting. One of the most unbelievable experience that I had in VR to this date, and that's really a great example, was with a virtual patient that had a neurological disease on the left side. And I asked him, like, could you sit upright? And that he will only understand the question. So he sat upright. It's much more natural than point and click or using controllers for that objective. And it's a real life communication. Like, we are talking, responding to each other. It's a very natural response that you get. And the moment that I leave the room to get medication, I felt really uncanny. To be polite, like, hey, I'm going to leave your room. I'm going to be right back. I find it really difficult just leaving the room. With other simulation, I thought, yeah, okay, it's a virtual patient that just leave the room, but it didn't sit right. And what was really interesting that with normal, almost every virtual reality applications, for example, I have a stethoscope and I go to my patient and some blue or other color highlights will appear. Then I can have interaction, for example, with the stethoscope. That's a great way to interact with your patient. And that is also included in tactile VR. But what tactile VR also offers is that something I never seen before. At one point, I'll be the virtual patient. He's lying on his bed, and I do this with my hand, just stroking beside the patient, and I ask to my patient, does this feel different? And to my surprise, he says, yeah, this does feel different. And I thought, like, I still can't it's really mind blowing. I can't wrap my head around it. Like, he understands my question in regards to his neurological disease. My left side will have a less sensation, and also understands my position in regards to his own position as a patient. Like, it was an absolute. I still need to. It's really mind blowing. Yeah,
No, Martin, listen, let's go there. Let's dig into that because I
yeah,
think basically essentially what you're explaining in a very articulate way is around the fidelity of the simulation, the
yeah,
fidelity, extremely, and it's not even just the fidelity of the an immersiveness
yeah,
of the actor. It's actually the response and the feedback from the patient. So let's go there, Martin. I just want to double click on really the how the patient mimics the treatment or indeed responds to the
yeah,
treatment through vital signs and
yeah,
indeed
yeah,
and the symptoms and the disease profile versus what what the actor or indeed the clinician does can be really seen in the physiology of the patient.
yeah.
Could you talk us through that?
Yeah, that's one of the great benefits and absolutely innovative ways of simulation training that I've never seen before. And it's absolutely mind blowing. Like, for example, uh, one of the you are allowed to make mistakes. It's a really great, strong learning tool. Of course, you need to be aware that it's appropriate to the proficiency of the learner, but you are allowed to make mistakes. On the other hand, other applications, if I pick the wrong medication, I'm not being able to. I'm being I can't pick up the wrong medication. What tactile VR does is you're allowed to pick any medication you want and to give any amount you want at any time. Hopefully, you will do it in the right way, the appropriate way, and with doctor's order. But you're allowed to make so. In a great video on the website of Tactile VR, you will see a patient that is giving a certain medication that will immediately lead to a very high heart rate. And not only will you see it on the virtual monitor, it will as everything in real time. You will see the difference in the vital signs in the monitor, but also you will see that the patient will utter certain complaints like I have a chest pain, the posture will change, they will show elements of discomfort. And in that example, the medication giving leads up to a cardiac arrest. So you will see from a sinus rhythm to a VTAC and a cardiac arrest situation. And then the patient will lie completely motionless, as of course a real life patient in a cardiac arrest setting. And if I would listen to the heart or lung sounds, I won't hear anything. And that's all being guided by AI. It's mind blowing.
So let's look at another aspect, which is titration of IV therapy into sort of AI-driven pathology and physiology.
Yeah,
I think one of the things you're speaking to here, Martin, which is extremely powerful, is this concept of bundles of care. And, giving a bundle or a package of care to the patient will be seen in a kind of reciprocity. So the patient will mimic the efficiency and effectiveness of the bundle given. Could you speak to the fidelity of that within even titrating IV medications?
yeah. As I tried to explain it, like everything is being safeguarded by the evidence-based and scientific reviewed database. That is where the AI looks for like, okay, how do I need to respond to interventions being done? So that's absolutely being safeguarded. That's very important, and everything set to a high standard of best evidence practice. Uh, that being said, like the IV titration, what you often will see is not really so, but often you will see direct interventions. Like I need to perform this intervention, I need to give this medication, and uh, not very many applications also have a little delayed treatment plan. Or, for example, if I would give IV titration, it could be that the adverse response will be in 30 minutes or 40. Not you won't need to, you will have very long assimilation training, but it will give a certain addition to your clinical reasoning. Like if I have a cardiac patient and I give too much fluid, he might come shortness of breath or something like that. You can have anaphylactic reaction because of the IV medication that you give. So it gives an additional layer of certain environments like critical care or intensive care or cardiac care units. Also adds an element of clinical reasoning, and yeah, different working environments, of course.
So
Yeah,
let's pivot slightly, Martin, and look at some of the emotional responses featured within the package,
yeah,
because I think psychiatric care and indeed psychiatric symptomatology is a huge facet of both standard practice and critical care. Could I get you to
yeah.
speak to how the just the tactile VR package really addresses psychiatric disease, and indeed how that's seen, the anger, the aggression in training scenarios, maybe the psychiatric disorders, and just also some of the benefits of simulating these emotions for medical students.
Yeah, like one of the most important aspects of nursing or any healthcare profession, of course, is how can I get a good contact with my patient so that he or she allows me to start treatment or perform checking the vital signs. And often, and that's of course the difficulty of VR, like it's always, as in physical simulation training, there's always that element of it's not a real patient. I've never experienced a real patient using plastic mannequin, not being disrespectful, but it's always non-expression in the face, it's completely lying still. It's always a young man or a woman, uh, but that is such an important factor. And the difficulty is that when you train soft skills training, either you do that with a patient actor or communication actor, and that's always a little bit peer pressure. Maybe you are in a group of students. It's always, it feels a little bit uncanny. I've always struggled with it because in the back of my mind, I always had like, it's not real. Although with a good communication actor, you can have a realistic simulation training, of course. Uh, but what the benefit is of this is that the way the detailed of the patient mental state or psychiatric state or happiness or sadness can really be tailored into a sliding scale. That means I can choose a patient is very fearful or completely trustworthy. He has anger issues or completely doesn't have anger issues, but also manic or completely manic or depressed, and everything in between. And that means that if I set the complexity matching the student's proficiency to, if I don't use the right communication soft skills, the patient will not have a rapport with me and will refuse the treatment. And that will be a very short simulation training. And of course, but that is how realistic it can be, because if I don't use the right soft skills or approach to a patient in real life, it is the same way. And what is really unique that often you will see children or adolescents in virtual reality simulation training, but in tactile VR, when I approach a young child, 13, 14 years, he will act and respond as a child of 13, 14, like where's my mama and where's my daddy, and What is this? It's really unique, and you automatically need to. You do that automatically and subconsciously, but you need to change the way you use your approach. What words do you use? Otherwise, the virtual child will not understand what you mean.
Absolutely. I think that's of critical importance, really, because to your
Yeah,
point, Martin, it's really about the soft skills and the non-technical skills. As much as it is about the technical skills, actually, the
absolutely. Yeah.
non-technical skill interplay is absolutely vital. So, Martin, could you speak to the patient scenario editor, just how some of these customizable features from the VR technology and XR technology just really tailors the learning outcomes to the learner and indeed creates the specific environments for the learner?
Yeah, so in the patient and scenario editor, you will be able to not only modify the starting point of the, for example, mental state, like happy, completely trustworthy, or paranoid, schizophrenic, or not trusting anyone. So that can mental state can easily be changed and modified, the emotional state. But you can also say to AI, like, you don't trust the nurses coming into your room, and that is his beginning. So if I would come, and that's also a great video, when Will enters the room, the AI has like is completely untrusty. Like, yeah, there's another nurse, and stop with your chit chat, and you're trying to poison me. Because in the scenario editor, it's being literally typed like, you don't trust nurses. And the AI will take, okay, and will start from there. So that's a really great way to tailor-made scenarios for different working environments and also learning proficiency. You can also, for example, like the physiology can be changed, like pupil reaction to a light, or the ability to lift up the right arm less or more than the left arm due to neurological conditions. Lung sounds can be changed, or bowel sounds can be modified. Um, and yeah, everything can be changed, like skin color, skin discoloration, that kind of elements. So it's completely modifiable scenario and patient scenario.
I think what we'll do, Martin, as we'll ask a few more questions, but what we will do is put in the show notes links to the technology, because I think it's fantastic for people to be able to see the AI enhanced virtual reality
Yeah,
simulation, and like you said, how intuitive it is, and the feedback that you can get from it, because it absolutely is. Another really fascinating innovation within the technology, and I'd like you to speak to this if possible, is the multifunction and multiplayer option which is coming to the technology, because
yeah,
like you say, true to life, we're all in a clinical scenario together.
yeah.
How have you mimicked that within the XR technology?
Yeah, so the multiplayer possibility will be available coming soon, near the fall. And it will allow for 5 participants to join the same simulation training. So you're in the same virtual room. You will see the same virtual patient. Great aspect is that you don't have to be in the same physical space or city or even country. One could be in the USA, the other in the UK, another one in the Netherlands. You will join the same simulation training, and it will have the same as any simulation with multidisciplinary simulation training. You could have a doctor and a nurse, or a nursing aide, or 5 nurses or 5 doctors, that can easily be changed. Uh, so you would have a realistic simulation training. You will see the same patient, and he or she will respond with the AI on everything you do and say. So that's the same outcome. In addition, there will be, of course, now you have one patient, one virtual patient, that also will be changed, modified, that you can have multiple bystanders or family members, or virtual colleagues. So that means you will have to use de-escalation techniques to have distressed family members to try to calm them down so you can perform your interventions, or you can delegate virtual colleagues like can you do this for me, and that you can take on the team role. Yeah, and I think that's a really great benefit, especially the multiplayer function, because it will have a great effect on multidisciplinary simulation training in a very safe environment.
Yeah, indeed, indeed. And like you said, the adage is you can have teams of multinational players, so you don't. It can be a quite a disparate team from different areas of the
Yeah,
globe, which is fantastic, actually.
yeah, yeah, certainly.
Could I get you to speak to something which we really haven't seen much of in the past, which is an absolutely amazing function, really, and increases the fidelity, which is AI controlled family members and bystanders and colleagues, and
Yeah,
how these almost virtual participants can change and affect the dynamic of the medical scenario
yeah.
from introducing that social and ethical aspect to the training. Could I get you to speak to that?
Yeah, so what I really love about that way of simulation training is that it offers on the one hand a very objective grading system, because I often found that with physical simulation training with human instructors, there's always that degree of subjective and not being objective to the students. This allows for a complete objective grading system where you, as an instructor, can set up what elements or interventions or even communication can be graded. Uh, so yeah, you can have that ethical, for example, how will you act to a patient with a colored skin, for example? Do you, and you can even say, let the patient start that he feels is being discriminated. How do you interact with him? How do you respond to that? And just as a top of my mind, some time ago I read that, I need to say it correctly, people from the Netherlands Antilles, for example, when they go to a judge, out of respect for the judge, they won't look him right into the eye. It's a cultural element, as I understand it correctly. Could be a different group, but out of respect for an authority, they won't look the judge in the eyes. But in the Netherlands, with our cultural, if I don't look you right into the eye, I admit being guilty. So that's a really, well, then that means that that people, how do you say that they are receiving higher punishment because the judge thinks he doesn't look me in the eye, but that's a cultural element. So yeah, you can have several elements being placed in that.
So how does the AI integration of an AI controlled doctor enhance the learning experience for students, Martin?
Yeah, it's also a feature that I've never seen before, and it allows for me as a nurse to, as in real life, to call a physician responsible for the patient that I might have concerns, or I see certain changes in the vital signs and I'm not really sure what to do, or even in the electronic patient record, there's I need to give a certain medication at 6 o'clock. And I think like, hey, that's not the right medication or not the right time, or okay, I need to give medication to lower the blood pressure, but at this point, blood pressure is already low. And that point, as in real life, I can call the AI physician and answer my questions I might have, and I will call him and say, okay, I'm with this and this patient, and he knows which patient I talk about, of course, and I say like, hey, I need to give medication to lower his blood pressure, but I took the vital sign, and his blood pressure is a certain amount, and then he will relay his advice on again, safeguarded by best practice and scientific reviewed database, and he will give the best advice. For example, I have a patient that might be in sepsis, and he'll say, I utter my what I observe, like he's low blood pressure and he has a fever and he's deteriorating. He's not really consciousness. He's really conscious. And the AI doctor will say, okay, let's start with a broad spectrum antibiotics, and every 30 minutes you need to do this. And if this happens, if the blood pressure even comes lower, call me again. And you can also, what is really kind of a joke, but I really like, is that the AI doctor will always have the time. I can, as a learning objective, I can ask him like, what is a broad spectrum antibiotics? What is the difference between a broad or a small spectrum? Or what is sepsis? And he will explain it in detail to me. So that adds an additional layer of gaining knowledge. So it's a fantastic application.
So just to come into land on the conversation, Martin, could I just get you to speak to what some of the future developments look like, or indeed enhancements we can expect for medical XR applications? Where do you see AI and XR transforming medical training in the future?
Yeah, I think like with I've seen AI before, but that's more the static AI, and especially in delegating virtual colleagues or communicating with your patient. But I really think that the AI will be much more comprehensive, much more detailed. You could think of specific rare diseases or specific working environments, outdoor region, hard to reach areas, or even, for example, tactical medicine or remote area or prolonged field care that have specific objectives, specific challenges, so that can be integrated, and the AI will take on the role of such a patient. And in the VR setting, what they are working on is also the mixed reality. So I can place my patient into, for example, the back of an ambulance, and I will see my own ambulance in real life. So, and I think the next step, and maybe it already is possible with tactile VR, but the next step will be that the AI understands a physical, how do you say it, a physical ampule, and I draw up the medicine and I will give it to the virtual patient, and that AI understands the amount and what medicine it is. So that will be a really great addition. And what I really like is, of course, addition of multiplayer simulation training, the addition of multiple family members or bystanders, and different working environments. So we're working on EMS and tactical medicine, critical incident simulation training tailor-made for that. But also, for example, for home care or for elderly care, or more specialized in critical care, birth control, that kind of elements. So I think that will be where there will be more additional features.
Listen, I think it's fantastic. And as you were saying, I think adoption is going to increase, but also fidelity is going to increase. And like you said, the response, the feedback, the immediate feedback from the AI is a fantastic mimic of what happens in reality, which is fantastic. Listen, we'll put links to tactile VR in the show notes, just so people can check it out. But I just want to say thank you for your time, Martin.
You're welcome. Thank you.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.